Managing your peristomal skin, or the skin around your stoma, is probably the most important thing to ensure that you have a good stoma care routine. So we'll think about, what is good peristomal skin first of all. Now we will put up a photograph now to show you what good peristomal skin looks like. And actually, the skin around your stoma should look like the rest of your skin on your abdomen. There shouldn't be any breaks or rashes or anything like that. So normal peristomal skin should just look like the rest of your abdomen. So one of the most common problems that people do complain about is that their skin does break down. And whenever you do experience this, and it's not that uncommon to be honest, and perhaps you will make contact with your stoma care nurse or your doctor to ask for advice. It's really important to identify exactly where the broken or sore skin is. So we'll think about the stoma. So the peristomal skin immediately next to your stoma, that can break down and get sore and weepy. And that would be quite a common thing. Now we can think about reasons that can happen. So one of the biggest reasons is that perhaps your pouch has been cut too big and that the effluent is actually going onto your skin and not directly into your bag. So that can mean that the skin can actually break down quite quickly in that area immediately next to the stoma. So how can we prevent that from happening? Number one is to make sure that the size of your pouch is cut out to exactly the shape and size of your stoma. If you have difficulty doing that, go back to your stoma care nurse and ask to get your stoma measured and sized. And there are certain pharmacies or certain delivery services that will cut your pouch out to the exact shape and size, and then a lot of companies do have pre-cut pouches as well. If it's an ongoing problem and perhaps the stoma is retracting in and coming back out again, and maybe that's causing a bit of irritation on the skin, you might need to think about an alternative pouch. If you're using a flat bag, you might need to talk to your stoma care nurse about perhaps trying a convex pouch. If you need a little bit of extra protection, a seal or a washer used around the stoma can prevent this problem from happening. And sometimes people who have maybe developed peristomal hernias and the shape and size of the stoma is changing, that can lead to the actual pouch not adhering really well next to the stoma, and a seal would work really well in that instance as well. Some other people like using a skin preparation wipe, and that just allows the pouch to adhere that little bit more securely down onto the skin if you are experiencing problems. So that would be a few hints and tips just to help you manage perhaps an area of sore skin immediately next to the stoma. Another common complaint would be that people complain about the area to the outside of the flange, a bit further out then to the outside of where the pouch is actually stuck onto your skin, and the skin there can actually start to deteriorate. The technical term for that is called skin stripping. So we will show you a photograph of that as well. A remedy to prevent that from happening is to use an adhesive remover spray. And really that allows you to remove your pouch without any trauma at all. Now there are some countries that having an adhesive remover spray isn't allowed within your prescription, or perhaps you'll have to buy it, and perhaps that's not possible for you. So if you even use warm water and hold your pouch away from the skin and just very gently wash it off the skin so that you're not just pulling the adhesive off your delicate peristomal skin. And that can also help prevent if you're not able to use an adhesive remover spray. Some people do suffer from eczema or dermatitis or psoriasis, and they can actually develop a much wider area of sore, aggravated peristomal skin. Or perhaps you've taken an allergic reaction or a sensitivity. Or for some gentlemen, that if you have a lot of hair on your abdomen and you are having to shave the skin around your stoma, you can develop a larger area of peristomal problems as well. A remedy for that, number one for shaving, is to try and only shave maybe every fortnight or every 3 weeks to reduce that inflammation. If you have psoriasis or eczema, go and speak to your dermatologist. There are some remedies for helping with a larger area of peristomal skin problems. you might need to use a steroid cream. If that is what has been recommended to you, the way that you would use that is that you take off your appliance and try and do it in a time whenever you might know that the stoma is actually quiet and it's functioning. You apply the cream down onto the irritated area, wrap a tissue around the stoma to catch any effluent that's coming out, allow the steroid cream to seep down into your skin, and then wipe it away, and that should not interfere with how the actual pouch then will adhere onto your skin.